Most seniors with sciatica watch their back pain, they track their leg pain, they monitor the burning and the shooting sensations. But nobody ever told them to watch their feet, and yet the feet are where the most important early warning signs of worsening sciatica appear, quietly, gradually, in ways that feel unrelated to the nerve until you understand the connection. 7 specific foot symptoms, each one directly connected to a specific aspect of sciatic nerve damage progression, each one appearing in the feet before the damage announces itself more seriously elsewhere. Tonight I am telling you exactly what each symptom means, exactly which part of the sciatic nerve it reflects, and exactly what action to take the moment you recognize any of them in your own feet. And real quick, if someone you know has been managing sciatica and has noticed any changes in their feet that they cannot explain, pause right now and send this video to them immediately. What they are about to hear could help them catch something important before it progresses further, and if you are not subscribed yet, hit that subscribe button right now. Every week, this channel brings you information that most appointments never cover. Now let us get completely into all 7. My name is Dr. Michael Kent, 20 years working with seniors managing sciatica. And the conversation I am having tonight is the one I wish every sciatica patient could hear in the first 6 months of their condition, before the foot symptoms that I am about to describe have progressed from early warning signs into established nerve damage patterns. Before the 7 symptoms, let me tell you about a patient. Details change to protect privacy. A senior in their early 70s came to me after 20 months of sciatica management. Their back and leg pain had been the focus of every appointment, every treatment, every conversation about their condition. But during our first detailed consultation, I asked something nobody had asked before. "Tell me about your feet." They paused. Then they described a list of things they had been experiencing for months. Cold feet that never seemed to warm up properly, occasional cramping at night, a tingling between the second and third toes on the affected side, and a vague weakness when trying to pull the foot up toward the shin that they had attributed to general aging. They had never mentioned any of these things to a previous provider. None of them had asked. Each one of those 4 symptoms told me something specific about what was happening to their sciatic nerve. Together, they painted a picture of progressive nerve compression that had been advancing for months while everyone focused on the back. We adjusted the treatment approach immediately and with urgency, informed by what the feet had revealed. Within 8 weeks, the progression had stabilized and 3 of the 4 foot symptoms had improved. Had we caught this earlier, had anyone looked at the feet earlier, the intervention would have been simpler and the recovery faster. Tonight, every senior watching gets the foot examination that their appointments have been missing. Here is what you need to understand before we go through all 7 symptoms. Your sciatic nerve is not one cable. It is a network. It originates from 5 nerve roots in the lumbar spine, L4, L5, S1, S2, and S3, travels through the buttock, divides in the back of the thigh into the tibial and common peroneal nerves, and eventually branches into every muscle and every patch of skin in the foot. The specific symptom you experience in a specific part of your foot corresponds to a specific nerve root or nerve branch, like a map. Understanding this map is what allows foot symptoms to tell you something precise and specific about where and how your sciatica is progressing. Tonight, I am giving you that map in the simplest possible language. Symptom 1, foot drop or difficulty lifting the foot. This is the most serious of the 7 symptoms and the one that requires the most urgent attention. Foot drop means the foot hangs downward and cannot be lifted properly at the ankle when walking, causing the foot to drag or requiring an exaggerated hip lifting gait to clear the foot from the ground. Foot drop is caused by compression or damage to the common peroneal nerve, a branch of the sciatic nerve that wraps around the outside of the knee and controls the muscles that lift the foot. The specific nerve root most commonly involved is L4 to L5, one of the most common levels of sciatic nerve origin. When compression at this level is severe enough to damage the motor fibers supplying the peroneal nerve, the foot lifting muscles lose their activation signal and weakness develops. If you have noticed any difficulty lifting your foot normally, any tendency to catch your toes on the floor or stairs, any need to lift your hip higher than usual to clear your foot during walking, this symptom requires urgent medical evaluation. Not a scheduled appointment in 6 weeks, an urgent appointment as soon as possible. Foot drop from nerve compression is reversible when addressed promptly. It becomes progressively less reversible the longer the compression continues without adequate intervention. Symptom 2. Numbness or loss of sensation. In the foot. Numbness in the foot, a reduced or absent sense of touch, temperature, or pressure, is one of the most consistently reported foot symptoms in seniors with progressing sciatica. And it is one of the most consistently misattributed to poor circulation, diabetes, or general aging rather than recognized as a direct nerve compression symptom. The location of the numbness tells you which nerve root is involved. Numbness on the top of the foot and between the first and second toes typically reflects L4 to L5 compression. Numbness on the outer edge of the foot and little toe side typically reflects L5 to S1 compression. Numbness on the sole of the foot reflects S1 to S2 involvement. The sensation of numbness means that the sensory nerve fibers in the sciatic nerve, the fibers carrying touch and temperature information from the foot to the brain, are being compressed sufficiently to impair their signal transmission. It is not dangerous in isolation, but it is a direct indicator of ongoing nerve compression that is progressing rather than resolving. Any new or worsening foot numbness in a sciatica patient warrants a prompt conversation with the managing healthcare provider and a reassessment of whether the current treatment approach is adequately addressing the underlying nerve compression. Symptom 3. Persistent cold feet. On the affected side, this is the symptom that most seniors attribute most consistently to poor circulation or cold weather. And in many cases, they are partially right. Poor circulation is involved. But the reason the circulation is poor in the affected foot is specific and directly connected to the sciatic nerve. The sciatic nerve carries not just motor and sensory fibers, but also sympathetic autonomic fibers that regulate blood vessel tone in the leg and foot. When the sciatic nerve is chronically compressed, these sympathetic fibers are affected, reducing their ability to regulate normal vasodilation in the blood vessels of the affected foot. The result is a chronically constricted blood vessel state in the foot on the affected side, producing the persistent coldness that most seniors notice when they compare their 2 feet and find a consistent temperature difference. Now here's where it gets interesting. Stay with me. The cold foot is not just a symptom. It is a driver. Chronically reduced blood flow to the foot means reduced oxygen delivery to the nerve tissue in the foot, which further sensitizes the peripheral nerve endings and amplifies the pain signals traveling back up the sciatic nerve toward the spine. The cold foot both signals the nerve compression and worsens its consequences simultaneously. Addressing the underlying nerve compression through comprehensive sciatica treatment is the only way to restore the sympathetic nerve regulation that allows normal foot temperature to return. Symptom 4. Tingling or pins and needles between specific toes. Tingling between specific toes, that classic pins and needles sensation, is one of the most precise diagnostic symptoms in the foot for identifying which level of sciatic nerve compression is active. Tingling between the first and second toes, the big toe and the one next to it, typically reflects L4 to L5 nerve root involvement. Tingling in the little toe and the toe beside it typically reflects L5 to S1 involvement. Tingling across the entire sole of the foot reflects S1 to S2 involvement. And tingling specifically in the big toe in isolation often reflects L4 nerve root involvement. This symptom is caused by irritation of the sensory nerve fibers at the compressed nerve root level, a phenomenon called paresthesia. The compressed nerve root sends spontaneous electrical signals to the brain that are interpreted as the tingling sensation even without any physical stimulus at the foot. Unlike numbness, which indicates fiber impairment, tingling indicates active nerve irritation. It is often the first foot symptom to appear as sciatica worsens and frequently the first to resolve as compression is reduced. Pay attention to which toes are involved and mention the specific location to your healthcare provider at your next appointment because it provides precise information about the nerve root level involved. Symptom 5. Weak ankle or difficulty standing on tiptoe. Try this right now. Stand near a wall for support. Rise up onto your tiptoes on both feet simultaneously. Now try on the affected side alone. If there is a noticeable difference in strength or height between the two sides, if the affected side cannot rise as high or hold the position as long, This is a significant symptom of S1 nerve root compromise. The S1 nerve root supplies the gastrocnemius and soleus muscles, the primary calf muscles responsible for plantar flexion, the movement that allows you to rise onto your toes. When S1 is compressed sufficiently to impair motor fiber transmission to these muscles, weakness develops, initially subtle, progressively more noticeable as compression continues, eventually reaching a point where the weakness is functionally significant, affecting the ability to walk normally, climb stairs, and maintain balance. Ankle weakness from S1 compromise also directly increases fall risk because the plantar flexion strength that allows you to catch yourself and recover balance during a stumble is reduced. For seniors with sciatica who are already dealing with the proprioceptive deficits from nerve damage, adding ankle weakness creates a compounded fall vulnerability that makes addressing the underlying nerve compression urgently important from a safety perspective. Symptom 6. Foot and calf. Cramps. At night. Nighttime cramps in the foot and calf. The sudden involuntary muscle contractions that wake seniors from sleep are one of the most reliably reported foot and leg symptoms in seniors with progressing sciatica. And they are almost universally attributed to dehydration, mineral deficiency, or poor circulation rather than recognized as a direct nerve supply disruption symptom. While dehydration and mineral deficiency can certainly cause cramps, in seniors with sciatica, the nighttime cramping pattern has a specific additional driver. The sciatic nerve provides the motor supply to the calf and foot muscles, and when this nerve supply is intermittently disrupted by positional compression during sleep, the muscles experience irregular and uncontrolled activation that produces the involuntary cramping contractions. The fact that the cramps occur specifically during sleep, when the body is horizontal and the nerve is in a different mechanical position than during waking hours, is the key clue that distinguishes sciatica-related cramping from simple dehydration or mineral deficiency cramping. If you are experiencing regular nighttime foot and calf cramps alongside your sciatica, ensure adequate magnesium and potassium intake, stay well hydrated, and specifically discuss the cramping pattern with your healthcare provider in the context of your sciatica progression, because addressing the nerve compression is the most effective long-term solution for the cramps. Symptom 7. One foot or calf appearing smaller than the other. This is the most serious chronic symptom on this list, and the one that most seniors notice without understanding its significance. If you look at your 2 calves or 2 feet and notice a measurable difference in size, and if one calf has visibly less muscle bulk than the other, this is a sign of neurogenic muscle atrophy. Muscle wasting caused by insufficient nerve supply rather than by disuse. When the sciatic nerve provides inadequate motor signals to the muscles of the leg and foot for an extended period, months to years of significant compression, those muscles progressively lose fiber density. Not because they are not being used, because the nerve signal telling them to maintain their fiber structure is consistently impaired. The result is visible muscle atrophy. A smaller, softer, less defined calf and foot on the affected side compared to the unaffected side. This symptom indicates that nerve damage has been occurring for a significant period of time. It is not an emergency in the way that sudden foot drop is. But it is an unambiguous signal that the sciatica has been progressing beyond pain management into nerve damage territory, and that the treatment approach needs to be reviewed with urgency and comprehensiveness. Here is your complete foot examination protocol. Perform it right now and then once every 2 weeks going forward. Sit comfortably with both feet visible. Compare the temperature of both feet. Press the back of your hand against each foot. Compare the color, any persistent difference in color or modeling between the 2 feet. Wiggle all 10 toes and note any difference in tingling, numbness, or sensation between the 2 sides. Rise onto your tiptoes separately on each foot and note any difference in strength. Look at both calves from the front and the side, any visible difference in muscle bulk. Perform 10 ankle raises on each foot and note any weakness or asymmetry. Any new finding in any of these tests, document it and bring it to your next healthcare appointment. The patient from our story had 4 of these 7 symptoms for months before anyone looked at their feet. 8 weeks of adjusted treatment after identification, 3 of 4 resolved. The feet had been telling the story the whole time. Nobody had listened. Tonight, you listen. Now, before you go, drop a comment right now. Tell me your age and your city, and tell me which of these 7 symptoms are you experiencing in your feet right now. I read every single comment personally. Share this with someone whose sciatica has been managed without anyone ever looking at their feet. Subscribe and turn on notifications because every week this channel brings you information this important. Look at your feet, listen to what they are telling you, and act on what you hear. This video is for educational purposes only and is not medical advice. All patient stories have been changed to protect privacy. Individual results vary. If you are experiencing sudden foot drop, loss of bladder or bowel control, or rapidly progressive weakness, seek immediate medical evaluation. The foot symptoms described are educational indicators. Proper diagnosis requires clinical assessment by a qualified healthcare provider. Always consult your healthcare provider for diagnosis and treatment decisions. Dr. Michael Kent is a senior health educator with 20 years of experience. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.